going to Turkey. Do you wanna know what's my honest opinion about that? Yes, go. But before you go, do your research because there are a lot of dental practices and dentists, just like everywhere else. So do your research, read the reviews, ask for recommendations, go there. As a dentist, I've seen a lot of scams too, but I've seen some amazing works, guys. So do your research. Try to avoid any social media posts, adverts, and things like that. Okay? The good guys, they don't need adverts. So go. Check Instagram, check everything, check the place, check the dentist, check the flow of the dentists on that place, check if they have history. I said yes. Why? My dentist said yes, I'm gonna go to Turkey. Okay, who's your dentist? Wow. He said to me that if I go to Turkey and I do my research, I'm gonna have my beautiful smile back. I don't believe that. Your dentist shouldn't say that to you. So now you're gonna ask me, why did you say yes, go to Turkey? I would say yes, go to everywhere. That's my opinion, guys. Dentistry is good. Dentistry evolved everywhere. It's not just in the UK. It's not just in the United States. Dentistry evolved everywhere. The only issue is, are you going to the right place or not? So, before you book your flight, I'm gonna show you a quick video for an example. As a disclaimer, I can quickly tell you that I'm not judging anyone. I'm just giving my personal point of view of the case. Okay, let's watch. So I'm gonna quickly stop here. You've watched some videos like that, but you notice that girl had beautiful teeth. Look at that, guys. Look at that. So I'm gonna call that perfect symmetry. So we do have the central incisors ever so slightly longer, 1 to 2 millimeters than the lateral incisors. They usually slightly shorter, ever so slightly shorter. Then we have the canine. The canines, they are roughly about the same length in the smile like the central incisors, so they're normally a bit pointy. People call it the fang. 1 or 2 millimeters above the lateral incisor. So overall, we can see the smile arc is there, guys. I like it. It kind of follows the bottom lip, and beautiful teeth. What can I say? Let's continue. Fine. So that looks like a young lady to me. Young lady, beautiful young lady in her 20s. So she had some lip fillers, that's for sure. Also, she got crowns. So crowns, we're taking all of the enamel, all of the existing enamel of all the teeth, especially on the visible side. Normally, the visual side is like from the midline. We start counting 1, 2, 3, 4, 5, 6. It depends how wide the smile is. I think she has pretty wide smile. We need to check that later. But she got full crowns. She lost all her enamel completely and forever. We don't generate or regenerate enamel, guys. I'm sorry. So we see the temporaries. Even from now, we can see the smile arc is gone. At least this is how it looks. It's super flat. Fine, yeah. All the first 6 top teeth, 6 front teeth, they're totally flat. Then we see a bit shorter premolar, the first premolar there. But yeah, flat. Fine, I just wanted to stop here and just show you a quick example. So, beautiful teeth. The shade probably is BL1, which is the whitest one in the Vita Shade guide. Basically, that's pure white. I'm not gonna say the other word, but that's pure white, which normally most of the people going to somewhere else, they expect that shade anyway. So I would say for young people, that looks pretty good. Of course, a bit quite unnatural, but that's their decision, guys. So I just wanted to show you quick. There we go. So We can see quite nice, quite flat, I would say. Unfortunately, the smile arc is totally gone. It's nice and flat. The upper arc of the lip, because of the fillers, it's not perfect, but it's still quite good. So no judgment there. Fine. There we go. Honestly, guys, I wouldn't do that. She literally had perfect teeth before she did that. Now she's gonna have to maintain that for the rest of her life. The work, I can't really tell, but the prep, I can't really tell you guys, but honestly, you should be ready for some issues in future. Obviously, she had quite nice, good oral hygiene. I would say I wouldn't classify it as a mistake. It's everybody's free to do whatever it's making them happy. So she looks really happy at the end, so I'm quite happy with that as well. The question is the ethics here. This is forever. Crowns can fail. You need regular hygiene visits. Don't expect if you brush once a day or once in a while and not flossing and not visiting regular hygiene visits, that's gonna stay. No, guys. If all the work is done nicely, it will be a lot easier for you to maintain, maybe even at home. Of course, every 6 months we always advise get a hygiene clean. But if the work was done and you know where the crown fits the tooth surface, it depends from the prep, to be honest. If there is even the slightest edge or ridge between the restoration and the root surface, there will be plaque. There will be a retention of plaque. Quite often that retention happens under the gum, and that small little ridge is actually under the gum, guys. So every time when we eat, obviously healthy gums does not allow any food, any bacterias, or at least the least amount of these things to get into the gums. They are nicely attached. But when you have artificial restoration, guys, under the gum, especially with the retentive factor, your gums will not look nice in future, for sure. Even if you're the best cleaner in the world, you will still need to persevere with regular hygiene visits. So it's not just the look, guys. It's always, we call it like white and red aesthetics. So we got the whitest white, but you need to think about the gums, and this much between the restoration and the tooth root surface. It needs to be seamless, guys. Gum heals, doesn't retain any plaque or bacteria. Gums are nice and healthy. You need to floss. You need to do water flossing. You need to do regular hygiene visit. That's it, guys. But that's for life. Some small aesthetical factors. Let me just show you. So, balanced smile. Balanced smile, we have 3 factors here on that photo. Lip line, the girl has fillers. And it's there, it's not looking bad for sure, it's looking pretty good. The smile arc, as far as we could see, it's gone, so it's totally flat. I'm not saying this is what I can see. Upper lip curvature, for me, the curvature is actually opposite. You know, when we smile, it needs to, normally the lip creates that small. You see how it follows. My teeth are far away from perfect, but the center of the upper lip, it's just like a bit curved there. I have a really nice example, guys. So I like to give examples with Angelina Jolie. So we can see the upper teeth. There is a slight curvature on the upper teeth. Can you see it? It's partially because of the position of the photo, but you can see the upper lip actually follows that small curvature on the upper front teeth. So this is what I call nice smile. Not because it's Angelina Jolie and I'm a huge fan. Hello, Angelina. But even that, her lateral incisors and canines are slightly dispositioned away from the perfect occlusion. They still look quite good. So guys, yes, go to Turkey, go to Poland, go to the United States, go to Mexico, go to South Africa. I've seen amazing cases from all over the world, guys. I've seen amazing cases from Turkey. So, do your research. make sure you're going on a place where they will take care of you. Aftercare is really important, and always just deep search about reviews. Just check, guys. I think I'm gonna go in Bulgaria. Yeah. Okay, guys. Don't worry about it. Do your research. Ask your dentist. The only issue afterwards is if you have that extensive work somewhere else, there are just few people, and mainly they are specialists who can help you after that. And for the aftercare, which again I told you, full crown, mouth restoration, it's quite extensive work. So just think about that, guys. Just be mindful. It's not just like going there and get your teeth done. It's not like that, guys. No. Okay, I think I answered your question. I hope you're not gonna make silly mistakes, guys. And dental health is really important. I'm not gonna get into details, but it's really important. Gum health, also really important for everything. So think about that again, do your research, and be careful, guys.